Good afternoon, everybody. Happy Thursday. Um, Again, I hope you're all safe and sound and clean and virus free. Businesses are opening up all across the country, other places in the world. In many places in our country, United States, numbers are going down. In some places in our country, numbers are not going down yet. Some places in the world, they are restarting restrictions because of the number of cases going up. It is a dangerous time, it's a questionable time. It's very important to recognize that a vaccine is probably coming. We don't know for sure. We know that there are many companies across the globe working on vaccines. We talked about one recently in our country, a vaccine against the genetic material of the virus. We talked about one out of Oxford University in England that is its development is moving along. Without a vaccine, there is no protection. At least no protection without us continuing the precautions that we discussed many times. Facial coverings, social distancing, at least minimum of 6 feet, a lot of hand washing, soap and water. The CDC mentioned that they believe that transmission of the virus from a surface into you is more difficult to catch than they thought. It's not quantifiable how much more difficult it is. The take home here though is if there are viruses on any surface and you touch those viruses and there are viruses on your hands and you touch your face, there's still a chance you'll get that virus. So be careful with that information. We like information, but just be careful of trying to interpret that information. It's still a contagion. It's still a live virus, a virus, and it still can get you sick if you touch it and get it into your system. What I want to address today in particular is about people wanting to travel and visit relatives. You know, I come from a big family. I have 10 brothers and sisters. I have nieces and nephews and great nieces and nephews, and I lost count a long time ago. I would love to visit them all. Extended weekend coming up, right? Memorial Day. As a healthcare worker, I have to assume that I potentially may be a carrier. I have been tested. Antibody negative. Doesn't mean I can't contract it with any patient I see. I'm cautious. Everyone in my office, we wear a facial covering all day. A lot of hand washing. We keep our distance, 6 feet or more from each other. The bottom line is this. Number one, if you don't have to travel, if you don't have to visit relatives, don't. Use social media this year. If you question whether or not it's safe, well, It's not necessarily safe, but obviously there's different hierarchies of safety, right? A couple of my patients, a couple of my people, excuse me, had said that either they have a chronic illness that puts them at risk should they allow visitors to their home from, their family, from other places, other states, whatever being. And the answer is no. Sadly, the answer is no. If you are in a high risk group, again, if you're older than 65, the older the higher the risk. If you have diabetes, if you have lung disease, if you're a smoker, if you're obese, if you have heart disease, if you have kidney disease, if you have lung disease, it is not safe. It's not safe to have visitors. It is not safe if you have those diseases to go visiting. This year, it is what it is. It is what it is. We have a virus, pandemic. It's a virus we are trying to understand, but are still learning about it. There are reports coming in from other parts of the world that are talking about how the virus is starting to present differently. We talked about children last week, the week before, that it's possible this virus is causing a Kawasaki disease-like illness in children and teenagers. If you could avoid traveling, avoid traveling. If you're considering traveling, first consider whether you or somebody else that you're going to be visiting has those risk factors. Remember that up to 50% of people with COVID, with SARS-CoV-2, have either no symptoms or very mild symptoms. Runny nose, scratchy throat. And those people are going to be the carriers. It's unfortunate but true that there is a respiratory virus going around the world, therefore a pandemic, that we don't have a vaccine for, that we don't have a treatment for, that's very easy to spread around, highly contagious, and fatal potentially for those high-risk groups. To those couple cases that asked me specifically on my page, no, it wouldn't be safe for you to travel. It wouldn't be safe for people to travel to see you. It wouldn't be safe if you have the pulmonary disease that you have and 90-plus-year-old mom coming to visit you. That's not a safe situation. We need to take precautions right now. We need to be cautious. If we don't, the virus continues to spread and continues to hospitalize people and continues to kill the most vulnerable in our societies. I care about you all. I pray you are all safe and sound and remain virus-free. I look forward to talking to you again tomorrow. Have a good night.